Well, good afternoon, everyone, and welcome to our COVID-19 daily briefing for Tuesday, November 10th. We will not be holding a COVID-19 briefing tomorrow due to Veterans Day, but we'll be back here on Thursday. And I want to encourage everyone to take some time tomorrow to honor our veterans. And if you're able, to find an organization near you that serves veterans and offer to volunteer in some fashion or to make a contribution. Our veterans deserve our respect and our dignity and deserve to live with dignity. And we should all do what we can to recognize their sacrifices on our behalf. I know many of us hoped not to still be fighting this deadly pandemic 9 months after it revealed itself. Way back in March and April, many Americans and those abroad had visions in their heads of somewhat a normal summer. or after that, a normal fall, and then eventually maybe a not so bad winter. We're all looking, hopefully, toward a better tomorrow, even as the public health experts warn of new waves of the virus as more people spend time inside in the months to come. We all want this to be over, but we need to gird ourselves for winter because it's not over yet. Neither has winter come, nor is the pandemic over. We have potentially months of the fight ahead of us. As hard as that sounds, yesterday we were given some real hope. A preliminary analysis of a new mRNA vaccine suggested 90% effectiveness in preventing COVID-19. That's potentially a very big deal. It proves not only that an effective vaccine might be on the horizon, but also that the multiple vaccines that use this new spike protein technology attacking the part of the virus that helps it latch onto human cells are on the right track. There are more trials ahead to determine if there are safety concerns, if the vaccine offers protection to those with prior COVID-19 exposure, if it protects against severe COVID-19, and if its effects on human immunity lasts an appropriate amount of time. But the news yesterday was potentially a very good sign of things to come. And as I've said in weeks past, we stand ready in Illinois to build the appropriate logistics chain to distribute vaccines to our state's residents. In the meantime, we're locked in a struggle with this virus as winter approaches. Today, I want to focus on COVID-19 hospitalizations. Across the state, the majority of our regions are seeing far higher rates of hospitalizations for COVID-19 than they ever did last spring. Outside of Cook and the Collar counties, much of Illinois' communities are experiencing the worst surge that they've seen yet. Region 1, northwestern Illinois, has nearly doubled where it was at its COVID-19 peak of hospitalizations in late May. In southern Illinois, Region 5 has more than doubled its hospitalization peak from the spring in late April. In central Illinois, Regions 2 and 3 have seen a 2.5 and a 3.2 times increase in hospitalizations, respectively, from their spring peaks in early April. And Region 6, East Central Illinois, has now surpassed 3.5 times its spring hospitalization rate. Even where things are not as awful, things are still bad. Region 4, the Metro East, and Region 7, Will and Kankakee counties, are running just above the worst that they saw in the spring, with no sign of slowing. Regions 8 and 9, the Collar counties, are close behind. Though still below their spring highs, things are close and they're increasing. Only Regions 10 and 11, suburban Cook and Chicago, remain a fair distance behind their worst hospitalization peaks in the spring by about half, but we're seeing concerning trends in suburban Cook County. Statewide, we're now averaging more than 4,200 patients with COVID-19 in the hospital. Our highest average in the spring was 4,822. 4,200 now, 4,800 back then. In short, we're now just hundreds short of our worst COVID hospitalization numbers last spring, after adding more than 2,000 to that number and that average since just October the 1st. I have been in touch with hospital leaders and with healthcare workers across the state. It's a difficult time for them. They're doing amazing work, but we must not let them become overrun. We're listening closely to them and we'll do everything to protect them. They have a message for everyone listening. They implore you to make sure that everyone wears a mask and stops gathering with a large number of people in your homes. They need your help. We're not alone in this fight. The nation is in a precarious place right now in this pandemic, and just as other states here in the Midwest and across the nation are imposing stricter measures to keep people safe, we are too. As I said last week and yesterday, we're monitoring the numbers closely, and additional statewide action is possible. We're also continuing to make sure that testing is as accessible as possible in Illinois. And indeed, we remain one of the top testing states in the nation and the best testing state in the Midwest. To that end, I'm pleased to announce that we've surpassed a new milestone in Illinois. We've recorded more than 100,000 tests in the last 24 hours, our first day of testing in the 6 digits, making us one of the first states to do so and the first in the Midwest. We know there's a renewed demand for testing statewide as positivity rates rise, so we're making every effort to keep building out our testing infrastructure, and this is a critical milestone in that endeavor. But it's critical to remember that nothing makes a bigger difference in this pandemic than when a community decides to protect your own, by wearing masks, by avoiding gatherings, by temporarily closing high-risk, high-exposure businesses until we get to a place where it's safer to open again. I know it feels like we've been at this a long time. The whole country, the whole world has. 9 months is a long time. But we can't let our guard down. Look at these numbers. More than 10,000 of our fellow Illinoisans are getting infected each day, and dozens are dying each day. There is light at the end of the pandemic tunnel, but we just don't know exactly when we will get there. So let's use the best tools that we have in the meantime: local enforcement, masks, distance. Stop having social gatherings for a while, and get your flu shot. Let's make a renewed effort to keep each other safe as we enter this holiday season. And with that, I'd like to turn it over to the Director of the Department of Public Health, Dr. Ngozi Ezike.
Good afternoon. Again, today reported an all-time high of newly identified COVID cases to the tune of 12,623. This brings our total number of cases in Illinois to 511,183. There were 79 new deaths reported for a total of 10,289 total lives lost to this deadly virus. Overnight, there were 4,742 people in the hospital with COVID-19. Of those, 911 were in the ICU and 399 were on ventilators. In the past 24 hours, again, as the governor mentioned, we had our first day over 100,000 tests being reported for a 24-hour period, which brings us to 8.5 million tests since the beginning of this pandemic. This week, our COVID-19 mobile testing sites are set up in cities and towns across Illinois, from the Highwood Public Library to the Hiawatha High School in Kirkland, to the Decatur Civic Center, to the Aquatic Zoo in Mount Vernon. These and many other places are offering free COVID-19 tests, no appointment necessary. Please visit our testing webpage for hours and locations, www.dph.illinois.gov/testing. Early on in this pandemic, there were actually requirements to get tested at our testing sites for this novel virus. That was because supplies and testing capacity was limited. But now, fast forward to today, anyone who wants a test can show up at one of our drive-through sites. I heard that at our Aurora site, even before we opened, there were 400 people in line to get tested. I really want to commend you, Governor, because you really had your foot on the gas pedal all along, and were really pushing us to get to this day. You did often talk about, what about getting to 100,000 a day? Well, we are here now. And I want to thank all of the people on the testing team who have made this milestone possible. Today, the only requirement to get tested at one of our testing sites is to be a responsible Illinoisan that wants to know their status and wants to know whether they have COVID or not so that they can protect those around them as quickly as possible. Please set the example for your family, for your friends, for your coworkers, for your community. If you've never gotten a COVID test, unless you've been literally indoors in your home for the entire 9 months, it's good to get one. Again, we have to just remind you of the same things we've been saying all along: mask up, wash up, back up, and sleeve up, referring to roll your sleeve up to get your flu shot. Regardless of what you may have seen on Twitterverse or at Facebook or Parler, we need to follow the science. These measures will work to get us on the other side of this pandemic. Please help us prevent the spread of COVID-19 and the spread of the flu. And let me add my salute to all the veterans who have done so much for us in this country. Buenas tardes a todos. Hoy estamos reportando 12,623 casos nuevos para un total de más de 511,000 casos de COVID-19 en Illinois. También hay 79 muertes adicionales para un total de más de 10,200 vidas perdidas. 4,742 personas estaban en el hospital durante la noche con COVID-19. De ellos, 911 pacientes estaban en la unidad de cuidados intensivos y 399 pacientes estaban en ventiladores. En las últimas 24 horas, más de 100,000 pruebas fueron hechas para un total de más de 8.5 millones de pruebas en Illinois. Esta semana, nuestras unidades móviles de pruebas COVID-19 están visitando varias ciudades y pueblos de Illinois, en lugares como Highwood, Kirkland, Decatur y en el Mount Vernon. Estos y muchos otros lugares ofrecen pruebas de COVID-19 por gratis y no necesitas cita. Por seguro hay líneas, pero simplemente visite nuestra página de web de pruebas para conocer los horarios y locaciones: www.dph.illinois.gov/testing. Recuerde al principio de esta pandemia cuando había requisitos para hacerse la prueba de este nuevo virus. Los recursos y la capacidad eran limitados. Ahora cualquier persona que quiera una prueba puede hacerlo. Felicito al gobernador Pritzker por poner su pie en el acelerador para que Illinois expandía las pruebas para cada rincón del estado. Hoy el único requisito para hacerse la prueba de COVID-19 es ser una persona de Illinois responsable. Sea el ejemplo para su familia, sus amigos y su comunidad. Terminó con las mismas palabras, los 3 M's. Usa su máscara, mantenga tu distancia y lávese las manos. No importa lo que haya visto en Twitter o en Facebook. Estas acciones funcionan y ayudan a prevenir la propagación de este virus. Muchísimas gracias para su apoyo. And with that, I'll turn it back over to Governor Pritzker.
Thank you, Dr. Ezike. Happy to take questions.
Regarding hospitalization numbers, Governor, perhaps is a question for Dr. Ezike. Are there discussions, are you expecting guidance in the near future regarding elective procedures at hospitals in order to conserve capacity?
We're watching those numbers very closely. It's one of the reasons that we talk to hospital leaders all the time. We want to make sure that we're, if we have to, that we're doing it at the proper moment, but that's not something that's right now needed. As you know, back in the spring, we did not know how fast things would move and to what peak. And so we, on the information that we had, we made decisions about elective surgeries. We also realized that there are things that get called elective surgeries that nevertheless are on the border of, are they necessary? So we want to, parse that out with the hospitals and make sure that if we ever do get to a point where we want to limit those elective surgeries, that we're doing it the right way.
Can hospitals take another economic hit if there is some sort of move on electives?
Look, you saw what happened when hospitals filled up in the spring. It's the same problem now, honestly. The answer is no. Hospitals, we can't take these kinds of hits all the time, and particularly for preserving our hospital capacity, we need to make sure that our hospitals are strong. And so we're working very hard to make sure that they have the dollars that they need to keep doing what they're doing, and also working with the federal government to bring more dollars to the hospitals.
Since the hospitalizations are going up, are you thinking about reopening McCormick Place or any of the 4 other hospitals that you turned into?
It's always something in the background, Amy, that whether we should, whether we would need to reopen a facility like that. But right now, we don't see that. It's not something that's right on the horizon. But we have the plans for it. We've done it once. If we need to do it, we'll do it again. You've heard that we have one hospital anyway that is sort of in warm condition, I would call it, so that we could open that one. And then, we have plans for going back to where we were if we needed to, but we're not there.
All right, so,
I was going to say, is there any concern about a shortage of healthcare workers at this time? We're hearing from
Yeah.
some hospitals, there are sick calls, not because they're getting sick in the hospital, but getting infected through community spread. Is there a concern regarding staff?
Always. I think the number one thing you hear from hospitals isn't so much do we have the space, it's do we have the staffing. And by the way, just like in the spring, when many, many states were suffering at the same time, and there was a demand for all of these workers in every state, it's very hard to get them when every state is looking for staff. There are staff that will move around from state to state that will, when you need them, but not if every state is demanding their services. So we're working with the hospitals, we're working with them because it's really their staffing efforts that we're trying to bolster. And you saw we made some adjustments in the spring to allow more people to get into the healthcare field, people coming back into the healthcare field who had retired, and we continue to offer that.
so we've had 5 days in a row, 10,000 plus new cases, or BBM was reporting possible cases of COVID. And what are possible cases of COVID? And why are they being included in the total?
I don't think they're not included. Yeah, the probable is a word that's, yeah. Well, here before, right, what those cases are, yeah.
Can you just reiterate, because people.
I'll let Dr. Ezike explain.
Thank you.
Okay. Again, with the advent of a large amount of this resource of the rapid antigen test, per the CDC definitions, when you get that positive test, that is listed as a probable case. The confirmed cases are our molecular tests. Now that number is growing. I think of the 101,000, about 5,000, 5,800 were of the antigen type. So you will see that when we say the total number of new cases, that's the confirmed test from the molecular tests with the antigen test, which form the probable cases.
And do you know what age group again? Is it nursing homes? Is it 20 to 29-year-olds?
Yeah, so in terms of the probable, or?
No, just overall.
Oh, all of it, all
12,000
ages.
was a record today.
No, all ages are getting diagnosed with this. I'm not looking at it on a day-to-day, but when I look at it over the week and several weeks, it's still, again, all ages are represented. The 20 to 30s take a little bit more than their proportion of the population, but it's a very even spread of it being having people affected in every single age group.
Doctor, do you recommend college students for Thanksgiving stay at campus, or should they come home to their families?
So that's a very loaded question, of course. We know that it also, there's so many nuances. Nothing is ever that simple. You have to remember that there are some college campuses where they have really gotten the infection rate so low because of aggressive testing, surveillance testing happening once or twice a week. And so in those cases, you actually have a populace that has a much lower positivity rate than a campus where there was no testing. And so there are larger amounts of infected people who may not even know it because they have not gone through that routine screening, and there are higher rates of positivity on those campuses. So, if you told me someone where the positivity rate is less than 1%, and there are campuses where the test positivity on their campus is less than 1%, that person is actually at risk going home. In their community, they have a higher test positivity than what they've experienced at campus. So it's not such a simple answer.
All right, we'll do one more in the room.
Oh, Governor, I know there's good news about the Pfizer COVID vaccine. Governor Cuomo reacted yesterday by saying it's bad news because President Trump is still in office. But didn't President Trump leave it up to the governors for distribution? And how will that work in Illinois once you get the vaccines?
Let's see, there's a bunch in there I want to answer. Yeah, so I don't know about the comments that Governor Cuomo is making, but look, it's only good news. So the vaccine is only good news. But as you know, and as I said in my remarks, it's still going to take some time here before it's been proved to be efficacious. It's been proved that, this was one phase. It was preliminary data. There's another set of data that will come to Pfizer from their trials, blind, trials, and they'll get that data, I think, in late November. And I don't know whether they'll release it. Remember, they released this information with a press release. It's up to them whether they release it or not, the information about how the process is coming along. But obviously, we're all rooting for it. And it's not the only one. Moderna and a few others have the same type of vaccine, and that's a very important thing to take note of, the type of vaccine. This one is proving seemingly to be more effective. And so, the fact that there are multiple companies developing things like that. And then you asked.
Will you get the dosage and decide how it's
Oh,
distributed?
yes. So we've put, first of all, we have a plan. We have a plan that's been developed back in.
Plan that you can look up online, actually.
Yeah, submitted back in October, and it's available to you. But importantly, you have to step back for a moment and understand that each of the vaccines is somewhat different. This one, for example, as I understand, requires that the vaccine be stored at 100 degrees below zero, the storage. So that makes distribution more difficult. I don't know how many facilities you're aware of that can hold 100 degree below zero, supplies, not many. And so we will need a lot of help from the federal government, there's no doubt about it, to deal with that problem. How do you store it? How do you ship it at 100 degrees below zero? And it just takes an awful lot. It's not something that's very easy. We don't manufacture that kind of equipment. The state of Illinois doesn't, and I'm not sure there's enough of that equipment for us. But I only say that to say we're going to work with whatever the capability is, whatever the vaccine that comes, we're going to build the capability to deliver that vaccine to the people of Illinois. And yes, you'll see in our plan when you go online that there's a list of the most vulnerable, the healthcare workers first, because we need them to be healthy while they're administering, and then, of course, the most vulnerable first.
All right, we'll go online. Jim Haggerty at the Rockford Advocate. Governor, with positivity rates soaring in some areas like Region 1, metrics that you're following show when these hard-hit areas will see a peak, or does that depend on how citizens follow mask mandates and other mitigation efforts?
The latter.
Or Dr. Ezike, sorry, this is from Dave McKinney at WBEZ, speak to the conditions at the LaSalle Veterans Home. How many residents are hospitalized and how many are on ventilators? How is staffing being handled with 70 staffers having tested positive? What is the outlook there? I'll
turn it over to Dr. Ezike for comment, but I will point out that this is a extraordinarily difficult, and troubling situation. Any, nursing home or long-term care facility, et cetera, especially because our Veterans Affairs Department has really done an outstanding job of keeping the veterans in our veterans' homes safe. They have. And so this is a blow to all of us. It's something that, they've been working against the entire time. It's also that people have asked us, well, why don't you just, not count the nursing homes when you count the regions or the positivity in a region or the positivity in a county? And the answer is because guess what? The people who work at facilities like this live in the area. And they're the ones who, no fault of their own, but you can asymptomatically bring in to work with you. Now we do have to screen for that. We do regular testing, very regular testing, but it can happen nonetheless. And once it comes into a facility, indoors, with a number of people there, even with all the precautions that people are taking, it can spread relatively quickly. Having said that, I don't know if you have anything to add.
No, I mean, I don't have the numbers at my fingertips, and I don't want to misquote, and I know the numbers have been changing, unfortunately, as the outbreak has grown, but it's a significant outbreak despite all of our best efforts and the aggressive testing and screening of staff and routine screening of staff and residents. So, you know, we're deploying all of our available resources to support that, to quell as possible. Going to be significant morbidity, and you know we'll be hoping for the best for all of the individuals at that facility.
John O'Connor at the AP. Have you or will you encourage House Democrats to vote against Speaker Madigan for Speaker? If reelected, isn't he a major distraction to your agenda in the spring?
That's a decision that members of the House will make. I know in January they'll be taking a vote on Speaker, and you know that's their business.
I know we answered this question already. It's from Jake Griffin at the Daily Herald, but Dr. Ezike, there are concerns adding probable cases each day has corrupted the data, sowed distrust, and artificially inflated case positivity. Why do you believe this method is best? Will you allow posting of actual and probable amounts on IDPH's website? Seems like we're living in conspiracy theory land, so if you'd like to...
So again, this is definitions established by the CDC. Other states are doing this. Check the Missouri website, check the California website, I think even the Florida website. So we are just aligning ourselves. The introduction of this very significant resource in the form of the antigen test, we have been given hundreds of thousands of this test, and we want to use them. But by definition, that falls in the probable category. If these people had not been tested with the Binax, with the rapid test, and instead had been tested with the traditional PCR, they still would have been cases. So it's just a matter of what testing method was used. It doesn't change the fact that these individuals have COVID, so they are COVID cases.
That's right. Let me just add that. Let me add one thing to that. I think the antigen test is a whole lot different than a PCR test. It's different, there's no doubt, and there's a sensitivity level that's slightly lower. And that's why the CDC, I think out of an abundance of caution, decided to label them as probable, because it is highly likely that if you got a test from an antigen test and you tested positive, you are positive. They just, I think we're out of an abundance of caution because the standard in the healthcare world is PCR testing. That's what we've been using for, and out of the 102,000 that we reported today, as Dr. Ezike said, it's almost 96,500 of them were PCR tests. So.
Tessa at WICS, we just received a tip from 2 lawmakers saying there might not be a veto session. What are your thoughts on this? Do you think there should be one despite a second wave of COVID?
Well, that would be disappointing. We have so much work to do in Springfield. There's no doubt, and I guess I know why people are concerned about gathering. I am discouraging gathering across the state, and so. But I must say it would be disappointing. We just have so many things we need to accomplish. With regard to the budget in particular, we have major efforts underway that will require the legislature's engagement. Indeed, I'm already working with a number of members of the legislature. I do not know whether they're going to not have a session, but again, it would be disappointing.
Shruti at Bloomberg, what is driving the COVID resurgence in Illinois, and particularly its velocity in the last month? Is it simply virus fatigue, spillover from bordering states, home gatherings, restaurant and bars, or some other factor?
I think you just named all of them. I think check. I mean, she's doing her homework. Let me say a couple of things. I read today that Iowa had 48% positivity. That means that in theory, out of every 2 people you run into, one of them might have COVID. And that we have a 13+% positivity, I believe, today, and that's terrible. It's not it's not 48, but it's terrible. So the other thing is, I think don't be fooled by just the case numbers. I mean, they're horrible. To say 12,000 people are infected is terrible. Take note that, that we're doing more testing than almost any other state. I mean, at 100,000 tests, you're going to reveal more. If you didn't do any tests in Illinois, you still would have thousands and thousands, more than 10,000 clearly, of people who are infected. If you could test everybody in the same day, you probably would find more than 12,000 people who test positive. And so I think, having said all that, these numbers are awful. Positivity rate is going the wrong direction. I think that's just as important as any other number we say to you is what direction is this headed and how fast is it heading in that direction?
Jim Leach at WMIY, are there projections for when hospitals around the state might reach bed and or ICU capacity, and what are the contingency plans?
The same contingency plan. I mean, we have similar contingency plans that we worked out in the spring. The difference is we've had months to shore them up, make sure that they're the right way to do it, that we can do it in an effective and relatively quick fashion. There are. I mean, it depends on how fast the numbers rise. And right now, they're rising at a linear rate, but they're on the cusp of going exponential. It's hard to tell when or if that would happen, and that's why we need everybody to please help us out. Help yourself out. Wear a mask, like everybody in this room, and encourage everybody to wear a mask. It really is hugely important that you do that when you're with other people.
A.D. Quigg at Cranes, between the fair tax gap and COVID's impact, how quickly do you think the General Assembly needs to act to tweak the budget, and what conversations have you had with the four tops about veto session? So
we have a meeting that's coming up. I have worked diligently, and we're going to need the General Assembly to step in here. There's a limited amount that the administration can do on its own. We're going to do all of that, and we need to make some significant cuts, and we need to look at the size of the budget deficit and to think about their trajectory going forward. And so those are all conversations that are happening now.
Jamie Monks at the Tribune, you've said you'll take away liquor and gaming licenses if businesses don't comply with your orders. As some restaurants continue indoor service, have you considered directing local health departments to pull food certificates as an enforcement measure? Why or why not? And that'll be our last one.
Oh, sure. And you've heard me talk about it, enforcement, I don't know, just about every day. And local public health departments do have some ability to remove licenses. And so I think local health departments are actually doing a reasonably good job. The problem is they're often subject to the politics of the county or the city that they're in, and sometimes the politics are that the local mayor or county board or city council just have chosen that they don't want to make any hard choices, and so they're not helping the local public health departments, who are the real professionals that everybody should be listening to.
All right, thanks everyone.
Thank you.